Hello, this is Dr. Carolyn Lam from the AHA Scientific Sessions, where we just heard the presentation of the Food HF trial results by Dr. Ambrish Pandey. Food HF was a randomized controlled trial. It's just pilot, though, open label, randomized 2 by 2 factorial trial, really addressing the food is medicine approach in a very vulnerable population of heart failure patients following hospitalization. It had many strengths. For example, unlike prior food intervention trials that compared food supplementation to usual care in patients with heart failure, this one compared two types of food intervention, namely fresh produce delivery versus really medically tailored meals delivery versus the usual care. And it also tested a very interesting hypothesis of whether food supplementation could be used as an incentive for healthcare behavioral change. So 2 by 2 factorial. The primary outcome was 90-day heart failure hospitalizations total and emergency department visits. In summary, the primary endpoint only occurred in there were only 32 events, and they were not different between the different arms of food supplementation with usual care. However, there was a secondary hierarchical composite endpoint that did appear to favor food supplementation, and this was driven mainly by a benefit in quality of life, so an improvement in the KCCQ CSS score. How about the other arm of the 2 by 2 factorial? That was the conditional versus unconditional delivery, conditional to the patient's behavior of clinic visits and medication refill. Well, again, there was no difference in the primary outcome. However, there was a sort of favorable in the secondary composite, again driven by gains in quality of life. Now, what have we learned from this? I think the most important message is that a food as medicine approach can be feasibly carried out in a very vulnerable population. So these trials are really, really difficult to do. They're expensive. You need multi-stakeholder engagement. And Food HF was successful in recruiting the 150 patients. And these were really racially diverse and represented patients who have a high vulnerability to food and nutrient insecurity. So exactly the kind of patients we should be looking at. And they managed to really deliver the food with very high fidelity. More than 90% of delivery was successful. They had strong patient engagement and adherence and good retention with only a 4% loss to follow up, and did an intention to treat analysis. So rigorously done and well thought out. So while the primary outcome was not significant, we have learned that perhaps patients prefer fresh produce delivery over medically tailored meals. And what does this mean? Well, maybe this points to the importance of autonomy in the selection of the way one prepares food, and points perhaps and supports personalized nutrition. The other thing that it shows is a conditional delivery was very interesting. And while it improved the patient experience, it wasn't actually through increased clinic visits or medication refill. So perhaps conditional delivery helps patient engagement and boosts their self-efficacy. And finally, much as the pilot provides important information for the design of future larger trials, there are a lot of unanswered questions. For example, the effect on clinical endpoints really needs a larger, longer trial. Which component of fresh produce should we be focusing on? Is it sodium restriction, caloric restriction, or something else like fiber? Which patient population may benefit more, HFpEF versus HFrEF? Are they different? Now, this was pilot 2 US centers only. So what's the generalizability outside the US? What's the scalability, cost effectiveness, sustainability? All these remain questions that need to be answered in the future trials.